Hello, my name is Doug Bolnick and I'm with the St. Charles County Department of Public Health. In this video and in our series of videos, we're going to be speaking with Department Director Demetrius Cianci-Chapman to answer a few common questions about COVID-19 and the response here in our county. Positive cases are tracked in the county where the person resides. Can you tell us what happens when St. Charles County learns about a positive case?
The first step when we learn about a positive case is to contact that person, find out who they've been in close contact with, and help them understand what they need to do as next steps, monitor their own health, and isolate themselves.
Could you tell me when someone should think about going to get tested and when they should get tested?
People should get tested for COVID-19 if they've had a known exposure or if they develop symptoms that are consistent with COVID-19.
One thing that we've heard on the news and we get a lot of questions about on social media is something where someone tests negative one day and tests positive another day. How is that possible?
Because the virus takes time to replicate inside the body. And when a person is first exposed to the virus and the virus enters their body, they're not going to test positive right away. Sometimes it can take 2 weeks for a person to test positive after an exposure.
Someone that's tested positive for COVID-19 or maybe exposed to someone is probably going to be asked to quarantine. What exactly does quarantining or isolation mean?
It means to separate oneself from other people to prevent the spread of disease.
So if you're asked to quarantine, where are some places that you can go?
Your home and only your home. You cannot go to the grocery store. You cannot go to your job. You cannot go to church. You cannot go anywhere in public. You can only be in your home.
And one thing that's a little confusing about this is that quarantine periods can differ in length. Why is that?
They differ in length because of exposure. So the quarantine for a person who has disease is typically going to be 10 days based on symptoms. The quarantine for people who've been exposed is 14 days, but it's 14 days from the last day they were exposed. So if during that 14 days they continue to be exposed, the clock starts over from the last day they were exposed.
Why is it important to trace who these people have contacted?
So that we can identify people that may have been infected with the disease, but have not developed symptoms yet and don't know that they may have been infected.
If someone is put under quarantine and needs assistance, where are some places they can go?
They can contact our hotline or they can go to the St. Charles County Department of Public Health website and there are resources listed there.
What's the purpose of contact tracing and who is contacted?
Contact tracing is a public health tool that has been around for a very long time. And basically, it is making contact with the people that have been exposed to a disease before they develop symptoms so that we can intervene. We can encourage them to get testing and we can isolate them as well.
And one of the buzzwords coming out from contact tracing is the term close contact. What does that mean?
The CDC's definition of a close contact is 6 feet for greater than 15 minutes.
When a contact tracer calls you, what kind of information is shared with others? Is it private or is it public information?
It's private. It's completely private information. All of our contact tracers are bound by the Health Insurance Portability and Accountability Act and have a high regard for people's privacy.
So if in the contact tracing process we discover one of the people that's been contacted may or may not be exposed, does everyone that's contact trace need to be tested?
Everyone does not need to be tested, but everybody does need to be isolated. Anyone who is a close contact needs to remain in isolation to see if symptoms develop.